Let's see about the physiological changes which is occurring in the mother during pregnancy. First, let's see the changes in the uterus. The uterus, as we all know, increases in size during pregnancy and it becomes an abdominal organ which was before a pelvic organ. At term, the uterus fills up a greater part of the abdominal cavity and it undergoes hypertrophy. Now the uterus becomes around 32 centimeters long, 24 centimeters wide, and it weighs almost 1 kg. This is at term, whereas normally the size of the uterus is 6.5 centimeter long and it weighs around 70 grams. Then coming to the shape, in first few weeks of pregnancy, the uterus becomes globular, then it becomes spherical in shape. And further it assumes an oval shape at the end of pregnancy. Coming to the uterine wall, the uterine wall undergoes hypertrophy, so there is thickening of the uterine wall, and at term it gradually thins. So as the uterus becomes thin, it gets softened and it is easily indentable. And also there occurs a little of hyperplasia along with hypertrophy. Hypertrophy is predominant, but there is also hyperplasia occurring in the uterus. Hypertrophy is stimulated mainly by the estrogen and the progesterone. Hypertrophy is by the estrogen and progesterone, whereas hyperplasia occurs only a lesser extent. Next we see an important sign called as Hegar sign. In Hegar sign, the uterus becomes softer just above the cervix. So the lower segment of the uterus becomes softer just above the cervix. So when the uterus is compressed between the fingers by doing bimanual pelvic examination, we feel the uterus being thin. This is called as Hegar sign, and this is positive in 6th to 8th week of gestation. Next, the position. The uterus as an abdominal organ is rotated to the right because of the presence of the sigmoid colon on the left. So, the uterus is dextro-rotated. Rotated towards the right due to the presence of rectosigmoid colon. So thereby the uterus undergoes dextro-rotation. Next, coming to the blood vessels. The arteries undergo hypertrophy. The vein also increases in size. Also the lymphatics, they multiply. Next, coming to the uterine blood flow. The uterine blood flow is increased to around 500 to 700 ml at term. And the uterus becomes contractile. So from the second trimester, we can feel the false contractions known as the Braxton Hicks contractions. These are infrequent and non-rhythmic. So these are also called as false labor pains in late pregnancy. These are all the changes we see in the uterus. Coming to the changes seen in the cervix. The cervix becomes soft and blue starting from the first trimester itself. This is due to increased vascularity. And also there is hypoplasia and hypertrophy of the cervical glands. And the cervical secretions increase, which plugs the cervical canal after conception, and this plug gets discharged only at the onset of labor. So this results in the bloody show. And the uterus becomes softened and ripened at near term. Next, the fallopian tube. The fallopian tube is stretched out and there is increased vascularity. Next, the round ligaments. The round ligaments are thickened and hypertrophied. Next, the ovaries. In ovaries, there is cessation of ovulation. And the ovaries are enlarged. The corpus luteum is the source of progesterone in the first 6 to 7 weeks of pregnancy, after which it contributes a little and placenta takes over the action. Next, the vagina. In the vagina, there is increased vascularity and there is violet discoloration of the vaginal mucosa. This is called as Chadwick's sign. Next, the secretions. The secretions are acidic, and this is due to lactobacillus acidophilus, which maintains the acidic medium. These are all the changes seen in the female genital tract. Next, the changes seen in the breast. In the breast, the changes are more common in primigravidas than in the multigravidas. And in the second month, there is increase in size of breast, and also there is increase in sensitivity. Also, there is bluish discoloration appearing as form of streaks. This is in the second month. Then in the 5th month, the nipple becomes more erectile, and the areola becomes very darkly pigmented. Next, there is formation of the Montgomery follicles. In the primary areola. So there is formation of Montgomery follicles in the primary areola. These are nothing but hypertrophied sebaceous glands. These are Montgomery follicles. These are seen in about 5th month. Next, there occurs the development of secondary areola. So, on development of secondary areola, there is also development of certain tubercles, and these become the secondary Montgomery follicles. Coming to the secretions from the breast, some amount of clear sticky fluid may be expelled from the nipples, and this is called as colostrum. This is physiological. So we have seen the changes which are seen during pregnancy in female genital tract and then the breast. So we will see the remaining in our next video. Thank you.